Good morning. I want to welcome everyone to the Berks County Commissioners Board meeting for December the 10th. We're broadcasting on BCTV, Microsoft Teams, YouTube Live, and Facebook Live. You want to put up the comments slide, please? There we go. Mary?
Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by the limitations of the platform being used, Teams, Q&A, Facebook, or YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to being interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much. As always, we will begin with a moment of silence followed by a pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We have a special presentation today. We're joined today by Ryan Bryce. He is the Executive Director of the Literacy Council of Reading Berks, and he's going to provide an update on the adult literacy programs being provided by the Literacy Council. Welcome to the program, Ryan.
Well, thank you, Commissioner Leinbach. It's a pleasure to be here. Thank you for the invitation for this morning. Good morning, everyone. And I will be brief in my comments, but on behalf of the Board of Directors of the Literacy Council, I want to thank the county for providing CARES Act funding to the Literacy Council during these unprecedented times, to use a phrase that everyone is tired of hearing. The Literacy Council of Reading Berks is celebrating, we're getting ready to start our 53rd year of service to residents here in Berks County, and we still have a lot of work to do in those here in Berks County. With the population of over 300,000, it is estimated through the most recent community survey that was done between 2013 and 2017, approximately 1 in 4 adults read at a level at or below a 3rd grade reading level. And adults that have low literacy skills often have greater health concerns. They often have greater health conditions because they struggle to understand health materials, or in the case of non-native English speakers, they struggle to communicate with their healthcare providers. These challenges impede their abilities to make decisions appropriate for their health. They lead to higher health-related costs and possibly even put others at risk. Adults with low literacy skills also face additional health concerns related to COVID-19. Highly literate adults, even health professionals, are learning new information about COVID-19 weekly. We're all learning information about COVID-19 weekly. So imagine what it's like for adults with limited English skills or limited literacy skills to take actions that can combat the virus. It can be even more confusing and even more daunting. So here at the Literacy Council, we provide GED preparation classes, English as a second language classes, workforce development programs, as well as other training to employers throughout the county to help increase the level of literacy of the adults here in Berks County. And one of our biggest partners is Reading Area Community College, and we are truly grateful for our relationship with the folks down at RAC, as well as other area secondary post-secondary education providers. But it is RAC and the Literacy Council who are truly working to combat this with great force. And even during this pandemic, we're learning and doing classes just like this on Google Teams, Google Meet, Microsoft Teams, and especially on Zoom. So we are truly grateful to the county for their support, and we're grateful to the residents of Berks County for their support and for supporting our local United Way, because we are a partner agency of the United Way of Berks County, and it is because of all of these funding sources and the community pulling together that we're able to provide better literacy services for members here in our community who live and work among all of us. So again, thank you for the opportunity to be here this morning. It's always great to see you all, and if you have any questions, I'm happy to answer them.
Sure. Thank you very much, Ryan. There probably is no skill more important than the ability to read, whether read in English or to read at all. And I just can't emphasize to our viewers how important the work that you and the Reading Berks Literacy Council does in providing this kind of help and support to folks that need this in our community.
Thank you.
Any comments or questions from my?
No questions. Just want to thank Ryan for all the work that excuse me, that they do and provide to the community. And I hope you have a Merry Christmas.
Yeah, you too, Michael, and all of you. Thank you.
Yes, thank you, Ryan. Okay, thank you very much, Ryan. Appreciate it. We'll have you on again sometime for an update. At this time, we're going to move to Brian Gottschall. Brian Gottschall is our director of the Berks County Department of Emergency Services. He is also the lead on the Berks County COVID-19 team, and he's here, as he is virtually every week, to present the latest data on COVID-19. Brian.
Good morning, Commissioners. Thank you. Thank you, Commissioner Leinbach, for standing in for me last week when I had a conflicting meeting and delivering this report. Unfortunately, the public has to get back to the junior varsity team because I'm back again now. So I'm going to share my screen here. And just let me know when you can see it. Looks like it's up. Okay, so this is our data report for December 10th. As we do every week, we're going to step through our standard deck of slides that we try to use on a consistent basis. But at the back end of the presentation this week, we do have a couple other items that we'd like to speak about. So first of all, we review the Pennsylvania Early Warning Dashboard. Just a reminder, this is from last Friday. The state publishes this on Fridays. So because we're meeting on Thursday, the data we look at is approximately a week old. We see continuing upward trend in almost all indicators. Interestingly, the emergency department visits show down a little bit in the week that the Early Warning Dashboard indicates for. It's interesting. Again, this is Berks County data. This is not statewide data. And it anecdotally doesn't comport with what we would likely believe to be the case based on observation, but it is the data that's available, and it does say that there has been a decrease in the number of emergency department visits in that week. Taking a look at the data that we track here in Berks County, our ongoing cases and testing. Again, with the testing smoothed over a 7-day period, we continue to see that our testing counts are up significantly. We see upward and downward changes in that on a daily basis that are very severe, so that even when they're getting smoothed out here over a 7-day period, we still see some peaks and valleys in the data, if you will. However, it's worthy of note that despite the upward and downward trend of our testing, we see our case counts continuing to rise, and now rising rather sharply in the last couple weeks. Again, in the state data where they talk about positivity, it includes serial testing, people who are getting retested in nursing homes and places like that. Our data that we look at for positivity is first test positivity that excludes all those serial negatives. And we're now seeing, just a couple weeks ago, I was talking to you about how daily our positivity numbers were tipping over 20%, but that was kind of a day-by-day anomaly, and our smooth numbers were still tracking below 20%. Now we're seeing consistently numbers well above 30%, so that even our smooth numbers are tracking well above 35 and approaching 40% positivity. This is an interesting statistic because it's important to consider when you look at our percent positivity back in the spring, where we had up to, close to 30% positivity in some periods back in May. But think about how little testing we were doing. Really, the only people getting tested back in the spring were people that were really sick and producing at hospitals where they had testing capability. Now the testing is much more broadly available, and there are many more people getting testing with very mild symptoms or potentially even no symptoms in some cases, yet still we're seeing a significant percentage of those tests being individuals who are in fact positive for coronavirus. And then again, our case rate per 100,000 of population over a 7-day smoothing, of course, reflecting what we saw in the regular case rate analysis with the significant spike. Taking a look at where our hospitals are, again, they report to us on Friday, so this data is a little bit dated, but we can see continuous climb. Just a couple weeks ago, our total hospital inpatient known and suspected numbers were in the mid-100s. We're now above the mid-200s. This is going to come to play when we, in the back end of the slide deck here, when we talk about some additional things. But our hospitals are seeing quite a considerable number of people in-house with COVID or with suspected COVID awaiting testing results. On the good news front, because we want to make sure that we talk about both sides, we're not seeing case severity in the same way that we did back in the spring as a percentage of the total. In fact, we had a small reduction of patients who were on ventilators from 1 week to the next. I'm not a medical provider, but I can suppose that that's indicative of our healthcare professionals' ability to treat this disease in different ways and with different modalities that didn't exist back in the spring, which of course is good news for all of us. Our county by county snapshot, where we look at where Berks County ranks out against other counties in the Commonwealth, we continue to see us going down the list in the things we want to go down the list on, deaths per capita and cases per capita, while holding our own in testing per capita. Again, this is an unfortunate slide because our successes, for lack of a better term, are really more representative of other counties. Failures is the wrong word, of the problems that other counties are experiencing. So it's I guess in a way good for Berks County, but in reality it's only good for us because it's becoming increasingly bad for others. So these are a couple new slides that we wanted to talk about this week, just in light of current affairs, if you will. One of the things that many of us have heard back from members in the public who are skeptical about what's going on with this disease is the fact that much of it is blown out of proportion and that we're not really seeing more people dying than we would in any other given time. And I think that we've tried to be very honest and fair in acknowledging that there are many things about this disease and the response to this disease that are subjective and debatable, and that honest people trying to represent things as honestly as they can arrive at different conclusions and in essence argue the outcomes. But there are certain things about this that are factual, and the data shows these things unquestionably. And the first one of those that we want to talk about is the fact that people are simply not dying at a greater rate than they would anyway. That because somebody goes into the hospital, and they have a heart attack. But while they have a heart attack, they also have COVID, and that gets tagged as a COVID death. And there are reasons in the public health world and statistically that these things get tracked this way. And I can certainly accept that folks may believe that that's not an accurate representation of what went on. So the way to call that out is to take a look at the CDC data for deaths in general. And what this shows is that in 2020, we have 261,530 deaths that are attributed to COVID. And some of those may be debatable, and honest people may debate whether they should be in that number. But what is not debatable is the death of 2.7 approximately million people from all causes. And the fact that that number is 112% of what they refer to as expected deaths would be. So in essence, saying that excess deaths beyond the norm are up 12% this year. And we can look at that a little bit more closely in this next slide, where we show where this data is derived from. And the CDC tracks deaths every week in the United States. And this data, there's only so much we can show on the slide, of course. This data goes back to 2017. And we can see normal peaks and valleys as we go throughout the years in the number of deaths per week. And a lot of that has to do, you see that these deaths peak in the January timeframe, almost on an annual basis, because of wintertime illnesses like influenza that are hard, particularly on our elderly and at-risk population. But you can see a very normal and natural up and down trend in this data year over year until here we get to 2020. And we see all these weeks of increased deaths above the line. Again, want to represent the data as honestly and fairly as we can. That doesn't mean that every one of these deaths were caused by COVID. In fact, one could make an argument that perhaps some of these deaths are suicides that are being caused by the general status of our society, the general conditions in our society, somewhat related back to COVID. But the point I'm making is that there are other outriders in this data apart from COVID, but not outriders that explain the magnitude of these differences. I mean, we're talking thousands of deaths that, but for COVID, should not have happened. And that doesn't mean that the people that died would have lived another 10 or 15 years, but maybe they would have lived another year or two, and the human toll of that is undeniable. People who would argue that there aren't large number of folks dying and that those deaths are being caused by COVID are either not looking at the data or attempting to be willfully ignorant to make some point that is contrary to what the data clearly shows. And the last thing I want to take a look at is how this breaks out on an age basis. And one thing I want to emphasize about these slides, you notice that in each of these age groups, we have the gray lines that show the data from 2015 to 2019, 4 years of data, and we can see the lines are almost on top of each other. Year over year, this data is very smooth and very consistent from year to year. And then we have the 2020 data in red. And what we see is that at the end of these red lines, we see kind of a dip. And I just want to be emphatic in pointing out that this doesn't mean that in these age groups in 2020, less people are dying more recently. It's that the data hasn't caught up yet. This death reporting gets factored into the system. What is reported every week is what is on hand, but it takes weeks for deaths to get reported back into the system. So, you know, if we would say that this represents approximately week 50 of the year, and we come back and look at this data in a couple of weeks, we're going to see that the red line's not down low here. It's going to come back up where we would expect it to be as the reporting information gets caught up. But what is significant here is that we see that in these low age groups, we're not having dramatic numbers of deaths beyond the norm. As we get older, we are seeing more and more deaths above the norm. But in these low age groups, it is what people are saying. The young are not impacted to the point of mortality with respect to this disease. That doesn't mean that we don't have young people dying. We certainly do. There are 2 individuals in the county emergency services, a firefighter and a paramedic, both relatively young individuals in perhaps not great health, but reasonable health given our society, who both succumbed to this disease during this year. So this is happening. When we get up into these older age groups, again, we see the difference between the gray lines and the red line becomes significantly greater. And we're seeing that of course, a very large number of people in those age groups are dying beyond what we would consider the norm, what the CDC refers to as excess deaths. Again, our attempt here is really to point out to folks that while we can have a reasonable debate about what our society is doing in response to this disease, there are certain things about the disease that are unrefutable. And one of those things is that it is killing people in large numbers That's a subjective term, I accept it, in large numbers throughout our country and in Pennsylvania. The last thing I want to talk about is the impacts to our local hospitals. There's been much debate, and I would even argue much confusion based on media reports about the conditions at our local hospitals. And the reality is that our local hospitals are being affected. It is not business as usual. This doesn't mean that people aren't able to get care for critical conditions that need that care right now, but our hospitals are on guard. They're very worried about the volumes that they're seeing coming into their facilities. If anyone has been to the hospital, they know that wait times are up in the ED. It's very full. There are people being housed in parts of the hospital that normally they wouldn't be housed in, as they're waiting for availability in other parts. And commissioners, you have shared with a number of us in the leadership team a communication that you received recently from one of our local healthcare systems that had some very alarming language, saying that, you know, they're doing what they can, they're putting in place planning, they're modifying their operations, but that the leadership of this institution is concerned that within coming weeks, and I don't interpret that to mean that, you know, we're talking about next year in April, coming weeks, that institution could be faced with making decisions about having to turn away not only people seeking care for COVID, but people seeking care for other non-COVID critical conditions. That is alarming language, and that should be a wake-up call to our public that we need to be doing what we can. Remember that the actions that we take today don't do anything to fix problems that are upon us today. The actions that we take today to mitigate, to protect ourselves, to protect our families, to curb the spread of the disease are only going to be felt in 2 to 3 weeks. So we can't make things better, you know, on a dime. We can't turn a corner instantaneously. We can't, I guess the good news is the action that one of us takes today also doesn't make things worse today, but it does have effect in 2 weeks, in 3 weeks. And that means that we have the ability as a community to flatten the curve, to protect our hospitals, to change our approach today, to mask, to make some hard decisions about congregating with our friends and families, to be more diligent in our social distancing, taking the step back that we might otherwise not take, and do everything that all of us can do as individuals and families to help make a difference to our community as a whole. Don't quit your job. Don't lock yourself in your second floor bedroom and not come out for 3 months. No one is suggesting that those things are realistic responses. But if we all do what we can do in a realistic way, it means that we as a society don't end up having to then take those unrealistic actions under the direction of our public health authorities. We can fix the problem right now if we believe there's a problem and if we're willing to do what we can. So that's the end of the report, Commissioner. Thank you very much for the opportunity to speak to this.
Thank you very much, Brian. Some pretty sobering information, and I especially appreciate the data on deaths over the historic and projected expected deaths. All of that information, incidentally, is directly from the CDC and is readily available to the public. What you shared isn't something that is uniquely available to government sources. Any comments or questions from my colleagues before we move into the agenda?
Commissioners, just before the other commissioners weigh in, I will provide the, I did have them in my slides as citations, but I will provide the actual links to that death data in the to the IT department so they can post it with the presentation and so that the public can easily find it if they desire.
Great idea. We want people to know the sources. We're not making up this data. This is a verified national data. Any comments or questions? Okay. Thank you very much, Brian. Appreciate it. We'll look forward to your presentation next week. Are there any additions or corrections for the December 3rd Commissioner meeting minutes and December 8th operation meeting minutes? Hearing none, the minutes will stand approved as presented. We did hold 2 executive sessions. Both of them were yesterday, 12/9, one on personnel and one dealing with both personnel and litigation. Mary, is there public comment on specific agenda items?
There is not.
Thank you.
You're welcome.
Under the agenda, item 1, authorizing. Under that, Budget Department, adopt a resolution authorizing 2020 budget transfers in the amount of $48,072 and 2020 appropriations in the amount of $142,990 per listing dated December the 7th of 2020. We have several items listed under Human Resources. Authorize the appointment of Hyalyn Perez to forensic interviewer in the District Attorney's Office. Item 2, authorize the appointment of Hunter Ahrens to buyer in the Purchasing Department. And item number 3, authorize the promotion of Jocelyn Kiada from Office Support 2 in the Treasurer's Office to Tax Claim Manager in the Tax Claim Department. Item 4, authorize the transfer of Shirley Benzel from Manager of Customer Support Services, Facilities and Operations Department to Manager in the Treasurer's Office. Under Purchasing, adopt a resolution authorizing the award and the Director of Contracts and Procurements to execute 3 agreements as a result of an invitation to bid on inmate and resident clothing for a period of 1 year for the participating members of the Southeastern Pennsylvania Counties Cooperative Purchasing Board, including Berks County. The county reserves a right to extend the agreements for 2 additional and 1 additional year term upon mutual agreement of both parties at the awarded unit price. Just for clarification, this is another method of saving money by working with a number of southeastern Pennsylvania counties and making a much larger purchase, getting a better price point. The first award is to Victory Supply LLC out of Mount Pleasant, Tennessee. The Berks portion is $118,510.41. The second group is JAB Trading Industries LLC out of San Antonio, Texas. The Berks portion is $47,441.47. And then the third group is Bob Barker out of North Carolina. And the Berks portion is $24,135.95. We have 2 items listed under Commissioner Barnhart. Item A, adopt a resolution authorizing the appointment of Arlene Pimentel, Reading, PA, to the Berks County Public Library's Board of Directors for a 3-year term ending December 31st of 2023. And item B, adopt a resolution authorizing the reappointment of Deborah Noel, Morgantown, Pennsylvania, to the Berks County Public Library's Board of Directors for a 3-year term ending December 31st of 2023. There are several items listed under the Commissioners. Item A, adopt a resolution authorizing execution of the lease termination agreement between the County of Berks and the Opportunity House, terminating the lease agreement dated December 10th of 2015, an amendment dated January 9th of 2016 for leased premises on the 15th floor of the Berks County Services Center effective December 31st of 2020. Item B, adopt a resolution authorizing Robert Patrizio, Chief Financial Officer, to bind the county's excess workers' compensation insurance policy. Item C, adopt a resolution authorizing the chair to execute the Risk Control Service Agreement renewal effective January 1 of 2021 and ending December 31st of 2021. Item D, adopt a resolution authorizing execution of the Title 19 Medicaid Grant Agreement Amendment between the Pennsylvania Department of Human Services and the Pennsylvania Department of Aging and the Berks County Commissioners, Berks County Area Agency on Aging, to provide federal and state Medicaid funding to the Area Agency on Aging for July 1 of 2020 through June 30th of 2023. Item E, adopt a resolution directing the chief clerk to prepare and submit a letter on behalf of the Board of Commissioners to the Pennsylvania Department of Health designating Jeffrey Widener, Assistant Director for Planning and Technology, as the single point of contact to receive information for the county public safety answering point as defined in Act 112 of 2020. Item 2, a motion authorizing execution of contract agreements and amendments is furnished by the contract coordinator as set forth on the attached listing dated December the 8th of 2020. There are a total of 11 contracts, 1 with the Berksheim, 4 with Children and Youth Services, 2 with the Department of Emergency Services, 1 jointly with the District Attorney and Public Defender, 1 with Information Systems, 1 with the Berks County Jail, and 1 with the Berks County Library. And then finally, item 3, a motion to ratify and confirm payments as set forth in the Controller's Office voucher listing. It's dated December the 8th of 2020, and the payment of electronic transfers and employee payroll.
Motion to approve the agenda as presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The motion is carried. And with that, we'll turn now to our Berks County Treasurer, Mr. Dennis Adams, for the Treasurer's Report.
Good morning.
Good morning.
We have an opening balance today of $158,380,487.70. A balance to clear of $7,794,000 $4.01, with a balance to clear of, excuse me, $150,586,493.69.
Thank you very much. We'll turn now to our Berks County Controller, Sandy Graffius, with the Controller's Report.
Good morning. Okay, we have total accounts payable of $12,419,957.13. We had a payroll this week. $4,406,792.56 for a grand total of $16,826,749.69.
Thank you very much, Sandy. We'll move now to our Chief Administrative Officer, Ron Seaman.
Thank you, Commissioner. I'd just like to reach out to our fellow citizens who are of the Jewish faith as they begin ushering in the holiday season with the start of Hanukkah, or the Festival of Lights, this evening. Mm-hmm. And with that, I'd like to share a quotation attributed to Rabbi Moshe Davis, who says, "A candle is a small thing, but one candle can light another. And see how its own light increases as the candle gives its flame to the other. You are such a light." I think that's very fitting and proper in this point in our lives with the resurgence of COVID. I mean, I don't know of anything. I'm not a constitutional scholar, but I don't know of anything in the Bill of Rights that gives anyone unmitigated freedom to do as they please, when they please, how they please. And therefore, you know, I think we need to wake up as a country. Anyone who says it's my right to go unmasked, to make me wear a mask, is taking away my freedoms. is kidding themselves. No one has a right to inflict harm on someone else. And if by not wearing a mask, you're doing just that. I urge everyone, become that candle during this time, light someone else's flame, and let's get through this all together. Thank you.
Thank you very much, Ron. And we'll move now to reports from commissioners. Commissioner Barnhart.
Thank you, Commissioner Leinbach, and as well as everyone who's joined us today. And thank you to Brian Gottschall for your very on-point information. Hopefully the public has a lot more knowledge about how devastating this virus truly is. And Ron, hats off to you for your comments. Very emotional meeting here this morning. I want to talk about Cook County Wellness and contact tracing. They now have 24 contact tracers working here on behalf of Berks County. And some of the numbers are very troubling. Just this past week, 374 new contacts. Successfully have reached 78% of the people of the 374. In perspective, from June 3rd to November 4th, there was 2,806 contacts in Berks County. From November 5th to November 9th, there's already 1,661 contacts in the new system, showing the spike in volume of tracing work. And I want to commend Cook County Wellness for their efforts. We did budget a forecast of $1 million based on, in large part, with what we saw in other counties allocating untold millions of dollars for contact tracing. To date, Cook County Wellness has billed us about $51,000. I think that is an amazing achievement for a not-for-profit organization who was ready to go in early June to help us with contact tracing. And I'm just, my hat's off to the folks there at Cook County Wellness for doing Carolyn Basic and her team for doing a tremendous job. Please, when the phone rings and they're helping with contact tracing, please answer that phone and help us get through this crisis. We had our Mountain Penn Preserve Council of Governments meeting last night on virtually, and a lot of things are going on behind the scenes. One thing the city is working on and will probably be implementing in 2021 is changing the traffic at the pagoda. As you know, there's that very large atoll there of rock. They're going to be changing traffic flow to eliminate some of the congestion at the pagoda. We are also working a coordinated approach with all the municipalities on illegal dumping. We, through the county planning department and the various entities involved with the Council of Governments, are working on an application for a DCNR, the Department of Conservation and Natural Resources Trail Feasibility Study and Forest Study, which Ashley Showers is taking the lead in our planning department. And one of our members has really worked tremendously well on a pagoda trail, working through Doubletree and their affiliation. There will be approximately a 2-mile walking trail, very smooth walking trail from the pagoda, which meanders down Mount Penn through City Park, goes past many of the monuments and the history there at City Park, and then ends up at the front of the Doubletree. Are working with Doubletree for signage, as well as if in fact some of their guests moving forward would like to take a walk on the trail as something to do for an hour or so, to provide a shuttle service up to the pagoda to drop people off, so maybe they can just walk down from the pagoda as opposed to walking up and down. So Craig Poole's been a great advocate of this pagoda trail. It really doesn't require building a trail, it's already there. It's just connecting this trail that dumps into City Park and then comes through City Park down to the Doubletree. So good things are happening in the community, even though we're in some really tough times. People in our community and are standing tall, doing things for the betterment of the future. So thank you.
Thank you, Commissioner Barnhart. We'll move now to Commissioner Michael Rivera for his report.
Yes, thank you, Commissioner Leinbach. I'm going to thank Brian for the information that he presented. What he presented were facts. You can't argue with facts, as we can all see the numbers have been going up. So just want to urge that in this holiday season, we like to be with family, we like to be with friends. let's just be careful. I was talking this morning with someone when I came in here to the building, and they were saying about how is it that people that don't have any symptoms are really sick, and how can they get other people sick? And I was telling that person that actually it's the people that are asymptomatic that are the ones that are getting more people sick than those that are symptomatic, because when you see that someone's sick, you stay away from them. When you see someone that's asymptomatic, there's more comfort level, you get closer and your guard may be down. So please just be careful. We want to make sure that everyone is able to get through the holiday season into the new year as safe and as healthy as possible. Also, as an update on the New Start grant program, a great deal of the amount is out. We still have about a week to go, so hopefully before Christmas, all that money will be out in the hands of the small businesses that need that money so much to be able to continue to stay open and continue to grow as well. So again, thank you to everyone who took part in that, and Community First Fund who is handling that process for us. Just again, as a reminder, the commissioners had nothing to do with who got or did not get the money. That was handled all by Community First Fund. Also, as an update on the homelessness issue, we had been having issues, and this was going back a little bit and mentioned a few times. And in the area, we had been having issues as to what do we do with homeless men, homeless women, and homeless families that are COVID positive and they need to quarantine. There was nowhere to put them. Initially, we had been doing it in hotels. That's no longer an option. We looked at many other options. Finally, I'm glad to say today that as of right now, we're in the, actually the Redevelopment Authority is in the process of getting 3 campers, and they will be located in the grounds of the Hope Rescue Mission for those men that are determined COVID positive and need to quarantine. So they can't go to the shelter. So it's either they find somewhere to go or they stay out in the streets, which we don't want that either. So we do have 3 campers, possibly looking at 1 more to be able to house those men there, and Hope Rescue Mission will take care of them while they're in that process until they get better. Then they can go to the shelter where they were at. So that's something that I'm really happy about, that we're able to do that. There are some other things in the work as well for more of a long-term solution, and I'll be talking about that at a later point. And that's all I have. Commissioner Leinbach, back to you.
Thank you very much. I appreciate both of your comments. I want to note that Berks County government over the last number of days, the commissioners have been meeting virtually with department heads, elected officials, courts, various authorities, encouraging, more than encouraging, directing that we are limiting access to the county buildings. Only individuals with an appointment may come into the county buildings. That has been in place since April. We're reinforcing that. Our security folks know that. And security folks have a list of people that have appointments. So if you come to the county services center and you don't have an appointment, most likely you're going to be turned away. We also are having every county employee that is able to telework, and there are a number of different departments where that is being done, to work from home. Again, limiting the number of people going in and out of county facilities. I think it's just important that we at the county level do our part to protect our staff, to protect the public to the extent that we can. But then it's also true outside of county government. And all 3 commissioners, when we became aware of the data on deaths that Brian shared with our viewers today, asked Brian to share that information. We've all heard from people who said, I don't understand. This seems to be bogus. and I've actually had people say to me, the CDC shows that there's no appreciable difference in the death rate year over year in 2020 versus prior years. I dug into that after hearing that from someone I know very well. And I said, boy, that data doesn't seem to indicate that at all. And I sent it on to Brian. Brian then shared additional data with us. And I hope people see that. This is not just a slight blip above the projected deaths. It's dramatic. That one slide that shows, I believe, several prior years and the consistent number, and then all of a sudden in 2020, you see the spike. And Brian's correct, there could be other causes. But of all the causes we know, there's only one that can have the overall dramatic effect, and that's COVID-19. And I just encourage folks, there are a number of areas where people may disagree on mitigation or disagree on whether this business should be shut down or not shut down, and whether the governor or the president has the authority to do or not do certain things. But when we see data, factual data like this, it should cause us to say, this is a serious issue. I need to take it seriously. I need to take it seriously for my sake. I need to take it seriously for the sake of the people around me, my family, friends, and people you just might pass on the street. So please seriously consider that. And finally, I too want to wish all of those of the Jewish faith a happy Hanukkah. This commemorates a very historical point in Jewish history. Approximately 2 years BC, before, I take that back. It's 165 BC when the Maccabees defeated the Greek Syrians and then rededicated the temple. And Hanukkah actually means rededication. And so that begins for folks in the Jewish faith this evening. I just want to wish all of our Jewish friends, and we have a number of Jewish folks here in Berks County. We have a synagogue over in Wyomissing. Wish them a very happy Hanukkah. And with that, I will open it up. Are there comments from any of our row officers? Hearing none, we will move to public comment, and I will ask Mary Buer if she would please read the public comments.
Thank you. The first comment is from an agenda item from last week's agenda. It's from Crystal Kowalski from Wyomissing. I have a question about agenda item 443. Is this resolution in response to a corrective action plan for the PREA? Could you please give some details so we can understand the action? Thank you. John Archer, Spring Township. What are the commissioner's goals and objectives for 2021? Jane Palmer, Wyomissing. Good morning, commissioners. On November 18, students from the Center on Immigration at Cabrini Academy met via Zoom with Andrew Sharp, Deputy Director of Intergovernmental Affairs under Governor Wolf, and presented their arguments for closing the Berks Detention Center. They were given the same rebuttals the administration has presented during past visits. But Andrew did mention that the closure of Berks is one of the top topics they will be raising with the Biden administration and will be engaging with them in the coming weeks. He also said that they've tried negotiating with Berks County and offered financial incentives, but they were met with silence from county officials. Mr. Sharp's report of being met with silence from you commissioners is at odds with what you have told local advocates for shutting down the center. I would appreciate your response to this discrepancy. Melvia Ahmed from Why I'm Missing. Good morning, commissioners. Each week you ask if there are comments on the agenda. The public would have a better opportunity to meaningfully comment on current agenda items if the agenda was available before the commissioners' meeting day. Is it possible to make the agenda available 2 days before the meeting day? And that is the last of the comments.
Thank you, Mary. That will close our comments. I know that our Berks County Solicitor, Christine Sadler, has an answer for Crystal Kowalski's comment. Christine.
Commissioners, good morning. As an answer to Ms. Kowalski's question, the agenda item 443 from last week's agenda is not in response to any deficiencies or any corrective action plan. It is simply a matter of Chester County informed us that they would no longer be able to house our juveniles that we're holding in Chester County for PREA compliance, and we've now entered into a relationship with Lehigh County to hold juvenile offenders charged as adults at the Lehigh County prison.
Thank you very much. I'll open it up for any comments from my colleagues.
I'd just like to start by asking if, Christina, if you can please explain what PREA is for those who are watching.
Good point.
Sure, Commissioner. PREA is the Prison Rape Elimination Act. It's a federal legislation that was instituted a number of years ago to prevent sexual assaults or sexual offenses against inmates during their stay at a correctional facility. Okay. And it has to do with sight and sound barriers. It has to deal with housing juvenile offenders separate and apart from the adult population.
Okay, thank you.
Thank you very much. Any other comments from my colleagues?
Yes, I will respond to John Archer and to Jane Palmer, if I might. Sure. John, I think about this probably several times a week as to goals and objectives moving forward. Certainly, we are still in the deep depths of COVID-19, so at least for the better portion of 2021, it will be focused on those efforts to get us free and clear of this devastating virus. Also, as we always do, managing our budget effectively, working with budget and our chief administrative officer and others to make sure we're getting the biggest bang and the best bang for our buck, because the overwhelming majority of money that comes to the county is real estate property tax, and we hold that highly, that we want to make sure we get as much bang for the buck out of that money. The savings and technology team will continue into the foreseeable future to find more effective and efficient ways to manage our government. A lot of it is technology, but also it is proper allocation of employees as well. Big thing on the agenda is elections improvements, making sure as we've gone through the Act 77 and through the primary and general through Act 77 to make those improvements, potentially electronic poll books, and also the review of all of our 202 polling locations for ADA compliance. Again, that's a pretty robust list for elections, but that is something that's on the front burner. I mentioned the Mount Penn Preserve as one of those external things that I continue to work with as a member of that Council of Governments. Work with Pam Schupp, who came to us just in September, but has been thrust into a lot of different things to get us on a focused track of really improving economic development and opportunities for jobs here in Berks County, working side by side with Pam Schupp. And Stephanie Weaver, who came to us as our public information officer midsummer. Really haven't had a real opportunity to sit and kind of go over our goals and objectives as to really putting out as much information in a timely manner as we can. She's been reacting to crisis after crisis after crisis. So that'd be great to be able to go further with those two fine young ladies. The youth recreation field was mentioned here the last few weeks with big show coming to town at our youth recreation facility, providing state-of-the-art facilities for baseball, softball, and soccer for our community and for touring groups to come in to provide that opportunity for local athletes, but also to drive tourism and economic development in the Berks County, which is sorely needed. Again, on that line, working with the tourism folks, and would like to, because a lot of things have been put on the back burner with PennDOT and their struggles financially. We were really in the process of, over the next 10 to 12 years, on the 422 bypass improvements, the reconstruction of 422 bypass. Hopefully by mid-year of 2021, we can get back to the table and really start knuckling down on some of those things that have to be done prior to the reconstruction of 422 bypass. In response to Jane Palmer, I'm not going to use any disparaging comments, but your discussion with Andrew Sharp was sharply different than the one I had with Andrew and his team in the year of 2019. I took a great political risk meeting with representatives in Harrisburg of Andrew Sharp and the governor's budget office. And at no time was any financial money discussed. It was actually a retraction from what was originally proposed in the late spring, early summer of 2019 to provide job opportunities and replacement of lost rent for the building. But when it came to pass in early October, all of that was off the table. The state didn't have an alternative, didn't have money, and said, well, here's some ideas we think we could use your building for, but actually the county would have to make $4+ million of renovations to the building, and we could use it, but we really don't need it. So I don't know if Andrew's position has changed or the governor's office position has changed. I would have loved to have been on that call on November 18th and listen to what was being told to your group by the governor's office and Andrew Sharp, because as far as I'm concerned, I know Andrew Sharp. I have his number in my cell phone. I call him quite often relative to COVID-19 issues. The very first call I'm going to make after this meeting is over is calling Andrew Sharp and try to understand from him what was actually discussed on that November 18th call. Thank you, Jane.
Thank you very much, Commissioner Barnhart. I'm going to comment. John Archer, I saw your question, and it's a good question, but my first reaction was, forget about 2021. I want to get through 2020. That's my first objective. But more seriously, number one is continue budget focus. And the good news is that next week we will vote on the final version of the 2021 budget, and there will be no tax increase. We made that decision back in the spring when we were entering the COVID crisis. We set up the savings and efficiency team. Commissioner Barnhart leads that team, and we immediately made dramatic cuts, almost $5 million just in capital projects that were approved in the budget for 2020 that we pushed off to some future date, pushed off the jail. We were supposed to go into full-scale planning for a new jail. We put all of that on hold. It will happen sometime in the future, but it's not going to happen right now. So the budget is a very important area to all three commissioners. We focus on this, and we understand that there's cost involved with everything. The second area is COVID. COVID isn't going away anytime soon. It does impact us. It impacts our residents. It impacts businesses in our community. And we will continue to focus on what we need to do relative to COVID as vaccines become available and the county plays any kind of role with that type of distribution. we've made it very clear with the Commonwealth, the Department of Health, the Governor's Office, that we are prepared to do our part. We are in constant communication with our two local health care providers, Penn State St. Joe's, Tower Health, Reading Hospital. And we also have had these discussions with our COVID-19 health advisory panel that's been set up. So that will continue to be a focus until we actually get through the COVID pandemic. Transportation, and Commissioner Barnhart alluded to that, but transportation is a very important issue. It's not just about economics, it's also about public health and safety. And the two biggest projects, Berks 222 corridor, we need to get that ultimately to completion. Right now, the work that you see taking place involves intersection improvements, but ultimately that corridor will be 4 lanes all the way to Lehigh Valley, and hopefully at some point tying in to 22 and Route 100, but that is an important area. West Shore Bypass is critically important. It's an artery that doesn't really have an alternative route, and the funding is a problem. As many people know, in the Commonwealth, there's a major shortfall in transportation dollars. That's something the legislature and the governor are going to have to work on, but it is a priority as we look at transportation. Another area is passenger rail. In light of COVID, this study that was done and completed this year has not received as much visibility as I think it probably would have in a more normal year. But the bottom line is this is a first study that shows a plan that would not require annual subsidies from counties. And we are looking right now at the possibility of the formation of a tri-county authority, passenger rail authority, that would begin to look at the possibility of implementing passenger rail service from Berks through Montgomery, Chester County, ultimately that would go through Philly to New York and through Philly to Washington, D.C. Stay tuned. There's more coming on that. I also agree with Commissioner Barnhart. Having Pam Shupp-Manette on board as our deputy CAO has been a great asset to Ron Seaman in his role, especially during these challenging times. She's played a major role in the CARES Act application and distribution process to local businesses, nonprofits, educational institutions. But the other side of her role is the Berks County Economic Development Director, and continuing to make sure not the government creates jobs. We don't do that. We either are a hindrance or a help by our policies, our regulatory policies, taxing policy, etc. And economic development is a focus and will remain a major focus going forward. And then finally, and again, Commissioner Barnhart touched on this, it is so helpful to have somebody like Stephanie Weaver on board as our public relations officer. And I know initially when she was hired, the thought was, wait a minute, the county's going to waste money on marketing. No, her job is about doing a better job communicating with the public what we're doing, what we're involved in, getting feedback on various projects that are being looked at and considered. Up until the hiring of Stephanie Weaver, that was largely a hit or miss. We would try to get the word out, but we didn't have anyone focused on communicating information about projects, information about decisions, etc. And Stephanie's been doing a great job. It is true she's been pretty much buried in response to COVID and some of the related areas, but she is a great asset. So, John, that's a great question. It's something that I believe any business person will tell you. If you don't have goals in place that you can be focused on, the question is, where are you headed? I don't know how you lead a company. You can't lead a county if you're not headed in a particular direction and understand what the objective is, how you're going to get there, and what resources you need, whether they're money, their people, their time. And the commissioners are focused on a lot of these issues jointly. These are not things that are unique to me or unique to one of the other commissioners, but very good question. Appreciate it. And one other note, I believe, and we have Mary Jo Gibson on. Mary Jo is our chief clerk. She posts the agenda normally the day before the commissioners meeting. And it's the day before because we have to wait to have all of the HR items and any other items that are on the agenda. We don't have those finalized until the day before, but it is not, as a rule, posted the day of. It is posted on our website the day before. I don't know, Mary Jo, if you want to address that at all. If you don't have to, but.
I'll just confirm that, yes, sure. I'm not receiving information up until that Tuesday and sometimes Wednesday morning, depending on actions the commissioners have to take at a public meeting. I don't get them in time to post the agenda 2 days out.
Right, but it is normally posted on countyofberks.com Wednesday, which is the day before.
Right, by 4 o'clock. Mm-hmm.
Okay.
Yep.
Well, thank you very much, Mary Jo, and thank you for the work that you do. You're one of those individuals that's largely behind the scenes. Most people don't see or know that you're there, but you're the person that really pulls that agenda, all the resolutions, all the contracts, gets that to the commissioners so that we have that in advance of the meeting ourselves. So thank you very much. Any other comments from the commissioners?
Yeah, I have just a few comments here. I just want to ditto your comments, Commissioner Leinbach and Commissioner Barnhart, as well, in reference to our priorities for 2021. And also kudos to the new staff that we brought on here on the 13th floor. It's been a great addition to the team here and helping the county continue to move forward. The only thing I would like to add to our goals and focus is also a continued cooperation with the city, understanding the city is the county seat, so we want to make sure that we continue to work closely with them as we have been doing so far for the benefit both of the city and the rest of the county as well. So we're looking forward to a great 2021 and also finishing 2020 on a good note as well. Like I always say, we're in COVID. There's a lot of things going on because of COVID, but there have also been a lot of good things that have come out of this situation that we're going through as well.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. At this point, I will accept a motion to adjourn.
So moved.
Second.
The meeting stands adjourned.